Hey guys, my name is Chloe. This is our therapeutic communications video. I'm going to be your narrator, so here we go. Development happens all throughout the lifespan. However, there comes to a point in time when we as individuals enter a period of developmental decline. In this decline, the stage we encounter is known as the older adult stage. Erikson's stage of psychosocial development focuses on a person's relationship to family and culture as they go throughout the lifespan. According to this theory, individuals must complete a task before moving on to the next stage of development. The older adult falls into the last stage called the integrity versus despair stage. In this stage, adults review their lives with satisfaction with what they accomplished or regret from not completing life goals. As they enter this stage of development, patients often report feeling a loss of meaning to life. The job of the nurse caring for patients in this older adult stage is to make patients feel that their life has value and is meaningful. We can fulfill this mission by giving quality Christian care to each and every one of the patients we encounter. In this video, we're going to walk through the do's and don'ts of communicating with the older adult. The first section that we are going to focus on is self-expression. Listen closely.
Hi, Mr. Holcomb. My name is Chloe. I'm going to be your nurse today. I'm going to take your vital signs and I'm going to help you ambulate. Can you confirm your name and birth for me?
I have no idea what you just said. I don't know what them words mean, and I don't even know because you're talking a million miles an hour. So we're going to need to use some words I understand, and we also need to slow it down just a tad.
I said, my name is Chloe. I'm going to be your nurse today. I'm going to help you ambulate. I'm going to take your vital signs. Can you confirm your name and date of birth for me?
Not so sure what ambulate means, but not with that attitude.
Come on. Go!
Stop pushing.
Okay. Hey, Mr. Holcomb, my name is Chloe. I'm going to be your nurse today. Today we're going to help you get up. We're going to help you go to the bathroom because you just had surgery and we need to get you out of bed. I'm also going to take your blood pressure, your pulse rate, your temperature, and just do some assessments. Can you confirm your name and date of birth?
Ryan Holcomb, June 30th, 1943.
All right. So I'm just gonna be here for support, but I want you to do it a little all yourself, and I'm just gonna be here if you need me. You got it. You're doing great.
Takes a while.
I know. It's okay. Take your time. You're doing awesome. Okay. I just want you to push up on the bed, and I'm right here. You got it. Good. Okay. So slow and steady. All right. 1.
I appreciate the help. Ain't no way I was getting in there by myself.
Well, you're doing great.
I don't know about all that, but I do appreciate the help. It's very much needed.
Just go slowly, one foot in front of the other, take your time. Let's go to this side of the bed.
Okay.
All right, now slowly sit. Good.
Thank you.
You're welcome.
The first video was a perfect example of what not to do when communicating with an older adult. I talked way too fast, used a lot of medical jargon, and I was very pushy with Mr. Holcomb. In the second video, I talked much slower and was very concise with what I had to say. I refrained from using medical jargon to avoid confusion, and I also allowed him to move at his own pace. This is important because elderly patients cannot move as fast, and some may not understand the big medical terms.
There are several tips that you can use to improve your communication skills with the older adult. These include, but are not limited to, maintaining eye contact, using touch in an appropriate way, and using a variety of techniques such as the reality orientation technique and the remnants communication skill. Using these tips will allow you to provide quality Christian care for each individual patient, making them feel seen and important.
Hi, Mr. Holcomb. I'm your nurse today. I'm Mary Howell, and I will be giving you your 9 o'clock meds. Can I just check your name and date of birth? Can you say your name and date of birth, please?
Ryan Holcomb, birthday is June 30th, 1943. Are these the pills that are multicolored ones? Because those little ones that are
the circles. They're made of candies that I used to use.
Yeah, they're just your pills that I'm just gonna give you, and so here you go. Here's some water that you can take with.
Okay, so it's a lot different than when I was coming up.
Yeah, okay, I'm just gonna like come and check on you in like 10-15 minutes, just make sure you're doing okay, alright? Yeah, is there anything else I can do for you? Okay, awesome. Hi, Mr. Holcomb. I'm your student nurse today, Mary Howell, and I'm here to give you your 9 o'clock meds. Can I just check your name and date of birth?
Brian Holcomb, birthday is June 30th, 1943.
Okay, awesome. And I'm just here to give you your 9 o'clock meds. So.
Those are little multicolored circle ones. Those kind of remind me of the candies that we used to get at the store. You know, the M&Ms?
Yes,
Yeah.
no, they are just like that.
Okay, so yeah, they used to be singular.
Water.
They weren't prepackaged like they
Oh,
are
really?
now. Buying by a handful.
Oh, really? That's so great. Well, okay, I'll be back to check on you in about 10 to 15 minutes. Is there anything else I can get for you, Mr. Holcomb?
I think I'm fine.
Okay.
During the demonstration video you just watched, the remnants communication skill was used. As you can tell, most older adults enjoy sharing their past life experiences. It's important as a nurse to allow time for your older patients to do so. If you do so, you should listen with interest and be attentive to your patient's stories. Doing so will establish trust and build your relationship with the patient.
It is important to consider what barriers could interfere with communication and understanding when taking care of an elderly patient. Examples of some barriers to communication include hearing loss, vision impairments, language and cultural barriers, cognitive impairments, a nurse that talks too fast or doesn't speak clearly enough, using medical terminology, and then also the patient's education level. Patients with communication barriers may need assistance from other devices such as hearing aids or interpreters or the use of pictures to enhance their understanding. It is important to use clear and concise language when communicating with an elderly patient. Use words that are familiar to avoid confusion and to maximize their understanding. The nurse also needs to be aware of their personal perception of the message that they're giving, because that can alter the interpretation of the message that's being sent. Using media to communicate to a patient can enhance their understanding of the information that you're presenting to them. The use of printed material can be of assistance, but make sure you're using large black font on a light colored paper background so that it is easy for the patient to read. Pictures, physical demonstrations, and videos can be used to fortify patient education and to strengthen the understanding of the information. It's crucial for you as a nurse to present the information in a way that the patient can fully understand. If for some reason the patient doesn't understand the information being presented, they may turn to outside sources such as the internet or a family member for the information that they're needing, and the information that they find may be incomplete or inaccurate. When you're educating an older adult, they expect you to deliver information that they can understand and that is relevant to them. So make sure you're using good language, not using medical terminology, and you're using outside devices if necessary to make sure that they're getting what they need.
Good morning, Miss English. My name is Hailey. I'll be your student nurse today. I'm here.
Who are you?
I'm here to give you your COVID vaccine for the day, okay? Okay, 1, 2, 3.
What are you sitting in the hood?
All right, is there anything else I can do for you today?
What?
Okay, I'll be back to check on you in like 10 to 15 minutes, okay?
What are you saying? Where are you going?
Good morning, Miss English.
What? I can't hear you.
I'm here to give you your COVID vaccine.
Okay.
Okay? It's
Okay.
gonna go in your arm here, in your deltoid, okay?
Okay.
Okay, I'm gonna clean the spot here. Okay, ready? Big stick.
Thank you so much for explaining this. Other
You're
nurses just
welcome.
come in here and give me whatever the heck that they're trying to give.
Can I get anything for you?
No, I'm good. Thank
Okay.
you.
I'll be back to check on you in like 15 minutes, okay?
Okay, sounds good.
Okay.
When communicating with an older patient, it is always important to understand what type of communication to avoid with the patient. First off, you want to never ever call them by a pet name such as Granny, Gramps, Sweetheart, or Honey. You want to always refer to them by their last names first and then ask them what it is they like to be addressed as afterwards. Second off, you never want to address a patient sitting to the right or left of them. You always want to be sitting directly in front of the patient, talking directly to them and looking them directly into the eye. Another topic of conversation to avoid is the use of gestures with a loud tone or negative body language such as a mean facial expression. Sometimes the older patient is unable to hear very well, and that tone can be used as a negative connotation as if it's a command and whether or not it's demeaning. And also, it is important to never be standing over your patient because that could be a sign that you are trying to establish dominance over a patient, and we never, ever, ever want that.